On this episode, we'll talk about changing diet stages. We'll also talk about applying scar cream and endoscopic gastroplasty versus your gastric sleeve. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 130 of the AskDrA show. I am your host and I want to thank you for being here and sending your questions my way. You can always send me your questions. It'd be a pleasure, delightful to answer them here on your show. Of course, you can always use the hashtag AskDrA and through my Snapchat account and my personal Instagram account. I want a really quick message here. Number one, this show is free. And the content is free, and I don't pitch you anything or want to make you buy anything or I try to sell you anything. All I ask, if you know someone that can benefit out of this show, looking into gastric sleeve, looking into weight loss surgery, just pass the link, share it, all right? And number two, if you want the content in Spanish, because the other time I got a DM on my Instagram, someone was looking for the content in Spanish. This show is recorded in two languages, English and Spanish, and we'll place a link of the Spanish channel in the description, all right? So let's get into the show.
Can I stay longer in the soft foods phase?
Yes, okay, so you may be kind of skeptical, you may be kind of nervous jumping into the next phase. Okay, it's time. The surgeon knows this, you know this, and the guidelines exist because of a reason. This is very well studied. We've been doing this procedure for years, for over a decade now, and we have it down to the T. So when it's time and when we tell you, okay, it's time to jump a phase, it is okay to jump a phase. But I totally understand the patient. The patient may be kind of skeptical, may be kind of nervous to jump to the next phase. What am I going to feel? Will I be throwing up? Will it hurt? All these things going in through your mind here, through your head and spinning. And you may want to think, well, you know, I want to stay maybe an extra week on this diet phase. Is it possible? The answer is yes. Will something happen to you? The answer is no. You can go ahead and do so if you feel up for it. Nothing will happen. And whenever you feel up for it, you can start taking small bites, advancing to that next diet phase. Give it a try. Remember, nobody was born with a sleeve. Everybody learns. It's a new learning process. So go ahead and give it a shot, all right?
When can I use a scar cream on incisions?
Okay, scar cream, and that's something that we recommend at our practice. Even though we do very tiny incisions, we try to minimize the results down the road with some scar cream. In our practice, we don't recommend applying anything on those incisions for the first 15 days, nor submerging underwater like a bathtub or swimming pool. We try to avoid any moisture, including creams. So after 15 days, you may be able to start applying scar cream. It does help. It's a bit of a hassle. You need to apply it morning and evening, but the results 6 to 8 months down the road are really good.
What is the difference between gastric sleeve and endoscopic sleeve gastroplasty?
Okay, all right, you want to get me going here. All right, so the endoscopic gastroplasty, what is it? It's a brand new procedure, recent procedure that they go endoscopically, all right? It is outpatient. It is designed to be outpatient instead of surgically, and they're not removing anything like the gastric sleeve. So in theory, it sounds really nice because it's outpatient. You go in and they go endoscopically. What they do is with endoscopic suture, they stitch, and try to close the gap of that stomach, trying to reduce the stomach's capacity. What happens down the road? We don't know. I mean, we know at the first year, patients lose between 18–20% of the excess weight they have, all right? Sleeve, you're losing over 50 to 60, 70%. Our case, we got really high numbers to about 80, 85, 90% of your excess weight loss in our series. So the results are way better right now with a sleeve. They're going to say, the endoscopic, the GI doctors are going to say, well, this is a procedure that we don't remove part of the stomach, which is, they may look at it as a big plus. In our case, I see it a really good plus, removing the part of the stomach, doing the sleeve, complete sleeve, because that part of the stomach produces ghrelin, the hormone that produces head hunger. That's gone. You don't get that benefit with a gastroplasty. So better weight loss with the sleeve. You don't get the ghrelin away with the endoscopic procedure. And those stitches, anything that we've done in the past, history, all right? We used to have a procedure done called gastroplasty, vertical gastroplasty. They're very similar to the sleeve, but instead of doing the stapling and removing, they would do just the stapling and leave the staples there and the stomach in place. What happened with time, those staples would be disrupted and communication between the two stomachs would happen again, and the patient would recover again the weight. This may happen down the road with those anchors, with those sutures that are placed, and down the road may rupture and you have the big stomach back again. They're going to say that it's going to be reversible, that you can go in again and again and again endoscopically to close that gap. Well, we'd have to give it some time and see the results down the road. Right now, gastric sleeve, most popular procedure done in the United States for weight loss surgery, 2 years in a row. Really good results, and it's for a reason. All right, so that is it for episode 130 of the Ask Dr. A show. Question of the week is, did you have trouble advancing to the next diet phase? All right, if so, let me know down below. I'll be reading every one of the comments, and again, send me your questions. Thanks so much for being here. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.